Hi and welcome back to my channel. In today's video, I'm going to be sharing with you an update on my hair. So I went to the doctor and I had another round of blood work done. And if you've been following me, you know that whenever I have blood work done, I faint and I have to get a nurse to come to my house and take my blood. And of course I have to pay for that. I'm in Canada and I had blood work done and my results were fine except for my iron. This time it was much lower than my last test. So what I'm having done now is going to be an iron transfusion. So I have to have that done at the hospital. I'm very nervous to do that because it's an IV in my arm, and because I tend to faint whenever I have blood taken, I can't imagine that this will be much better. So my doctor is going to prescribe something for me to calm me down. So I'll take that an hour before my appointment. And hopefully this will help my iron improve and I don't have to take iron supplements because my stomach reacts kind of badly to them. I have IBS and iron is very hard on your digestive system. So that's the first thing. So low iron, and now I am going to be taking, I'm going to be doing an iron transfusion. The next thing is I'm most likely perimenopausal. I am 48 years old, and even though I'm still getting my monthly cycle, there are changes going on in my body, and hair is one of them. You can have excessive hair shedding when you are perimenopausal. So it's most likely that I am. Although my doctor did not check my hormones, she said that there's no point in doing it because my hormones will always be changing and fluctuating. So we're just assuming that I'm perimenopausal, which I'm sure I am. And we decided that I'm going to take, well, I am taking, I've been taking it for not quite 3 weeks. It's a drug called finasteride. And a lot of men take it when they experience hair loss and hair shedding. So it's okay for women to take it. Women normally don't take it because it can have side effects if you want to have a baby. Now, I'm obviously not having a baby, that ship has sailed, so it's okay for me to take it. And I wrote this down, what it does, because there was no way I was going to remember this. Finasteride is an A5-alpha reductase inhibitor, which works by blocking the conversion of testosterone to DHT, a hormone that causes hair follicles to shrink and hair loss. So that's what this drug apparently does, and it's supposed to be very effective, and there's very little side effects. Other than, of course, if you're a woman and you want to have a baby, then you should never take this medication. So that is what I'm doing now. I'm going to be having an iron transfusion and I'm taking finasteride. Now, always go see your doctor and have blood work done, find out what's going on. This is what's happening for me. And a lot of times if you're having hair issues, it's an indicator that there is something going on internally. So you always want to err on the side of caution and speak to your family doctor. So I'm not a doctor or a nurse. I'm just telling you about my experience, and hopefully if there's anybody out there who has similar issues, maybe this would help. But of course, I can't stress enough that one must go see their family doctor before doing anything. And for me, like the medication that I'm taking, you have to have a prescription. And of course, getting an iron transfusion, your doctor has to set that up for you. So I'm very nervous for this iron transfusion, and I will keep you posted about it. I have to have 2 of these transfusions. So my first one will be next week, and then I'm supposed to have another one the week after that. So this is just my little hair update. Please wish me the best of luck. And if you've had any experience with any of this, please leave it in the comment section down below. I want to thank you so much for being here, and if you enjoy my content, please subscribe to my channel, and if you like this video, please give it a thumbs up. Thank you again for being here, and I can't wait to see you all in my next video. Bye-bye.